I first saw Mike about 8 months ago for an injury to his left knee. He is an MMA fighter and a boxer, and he was training for an MMA fight, and he suffered a pretty severe injury to his left knee. He tore 2 ligaments in his knee, both very important ligaments: his anterior cruciate ligament, or ACL as it's commonly known, and his medial collateral ligament. And he was pretty concerned about his future, but given the techniques with ACL reconstruction today and how successful they are, I was very confident that we could get him back to both boxing and MMA fighting. So we rehabbed him for his MCL first. We got the MCL to heal on its own through rehab and bracing. And then after the MCL was healed, he underwent probably about a 30-minute procedure, which included an ACL reconstruction using a cadaver ligament, which was very successful. He was running in 10 weeks and started sparring, kind of boxing, probably by 4 months. He's worked really hard. He's now 7 months out, and he's getting ready for his first fight in a couple weeks here at the Sands. Well, Mike's a very motivated guy. He's the kind of patient that we love taking care of because he works so hard at the rehab. The surgery is obviously very important, how we place the graft, but the rehab is just as important. Being an MMA fighter, you also worry about compliance because these guys are pretty hardcore, but Mike has been very compliant. He's worked really, really hard, and he's had a very successful outcome. Surgery is about a 30-minute outpatient procedure. It involves 3 tiny little incisions. Mike will show those to you. We used the cadaver ligament, which is a ligament from a deceased person, and used it to provide a scaffold for his ACL. Yeah, the surgery is obviously a really important one. It's all about tunnel placement. We were able to get our tunnels placed perfectly. Right now, I think his knee is as stable, if not more stable, than his non-operative knee. I'm 100% confident he's fully recovered. I just examined his knee before this interview, and his knee's rock solid. He's been training really hard. He's going to fight this fight, and then we're going to move on to MMA, which involves a little bit more wrestling, which is probably a little more stressful for the knee, but I'm 100% confident that he'll do great.